Hello, my name is Hayden Muntz, and today I'm going to be doing a brief presentation on long-term care and available options for funding in regards to the government and private sector funding. I'm also going to be discussing the role that faith-based organizations play and have within long-term care. So first, I think it's important to discuss and go over the definition of long-term care and what exactly it is. Vogel gave his take on it by saying long-term care is a broad term that covers many levels of care that are funded by a variety of payment sources. It encompasses so many different forms of care that includes subacute hospital care, skilled nursing care, rehabilitation, assisted living, home health care, and community-based services. The two major forms of funding for long-term care is through government funding and private funding. The majority of government funding is through the programs Medicare and Medicaid. Research shows that Medicaid pays about 62% of costs, but however, most seniors remain ineligible. Unfortunately, to become eligible, many seniors find themselves financially exhausted and can no longer support themselves. There is a heavy reliance on direct funding from federal and state general tax revenues, and as the populace continues to get older and older, the dependence on these tax fundings continue to rise. Government funding can also be inconsistent as there are many shifts and regulations and funding. On the other side is the private sector. They consist of creating many different plans that invest in long-term care for an individual, such as legal, financial, insurance, and geriatric plans. Having long-term care funded by a private sector allows people to care for themselves longer and ensures quality care. The way that it is funded is from a mix of assets such as income, investment growth and earnings, and insurance benefits. However, private funding also runs the risk of not lasting as long because of its costs, resulting in dependence on government programs. All of this planning and paying is in vain, however, if we are not believers in Christ, and that is why faith-based organizations are so important. As the prevalence of faith-based organizations continue to rise, so do the disputes on how effective they are when compared to their secular counterparts. Faith-based organizations offer much more by investing in people's lives, preparing them for eternity, as well as answering social questions of our time that our government would otherwise come up short. Many faith-based organizations are also nonprofit, which can stress the value of care over making a profit. Faith-based care organizations also provide services and payment methods that traditional healthcare organizations would as well. And Christian Homes Care Community out of Holdridge, Nebraska is an example. Thank you so much for listening to this presentation on long-term care and how it's funded. I hope this information was useful and can lead you into a better decision between government and private funding.